I'm Dr. Coleman Martin, an interventional neurologist at the St. Luke's Marion Block Neuroscience Institute. This is Interventional Stroke Rounds. Today's patient tells her own story.
My name's Bonnie. I'm 27 years old, and I was on my way to work on Friday morning, and I got in a car accident and ran into a FedEx truck. My car's totaled. After the accident, I can picture the airbag, and I can picture my foot being broken, but that's all.
Bonnie was stabilized at another hospital and underwent reconstruction of her ankle. The accident injured her spleen, but she seemed to be stable until a new problem started.
I was having a stroke, and I couldn't use the right side of my body, I guess. They said my face was drooping.
Bonnie had an injury of her left carotid artery. Arteries are composed of three layers: the innermost intima, the muscle layer media, and the outer adventitia. If we look at the artery in longitudinal section, we can see that blood flows along the intima. A severe injury, such as a car accident, can compress the artery and tear the intima. As the blood flows up the carotid, a blood clot in the artery wall grows. This condition is called a carotid dissection, and it is a common cause of stroke in young people. The dissection narrowed her carotid artery and limited blood flow to the left side of her brain. Let me introduce her trauma surgeon, Dr. Beggs.
When Bonnie arrived, she did not look good. She was in obvious shock, and we were concerned about her carotid injury, but we also knew that she had a splenic injury.
We rushed Bonnie to the CT scanner. The brain CT suggested that we were early in the stroke. To make sure that the brain tissue was still salvageable, we obtained a CT perfusion scan. The blood was slow to enter the left hemisphere, but eventually it did arrive, a good sign. We also scanned Bonnie's abdomen and pelvis. Her radiologist, Dr. Andresen, joined us in the scanner control room.
See a large amount of blood associated with her spleen, and that is consistent with a shattered spleen, which is a surgical emergency.
Bonnie, what do you remember about your arrival at St. Luke's?
I remember being in the bed and being wheeled into a room with people in it, and I couldn't really see the people. I mean, I could see that there were people there, but I couldn't see a whole person at once. I could only see part of people.
Because the stroke was the more immediately threatening of the two problems, we whisked Bonnie to the neurointerventional operating suite. There I asked my partner, Dr. Holloway, to join me.
It's helpful to have two physicians who routinely perform these types of procedures during an emergency, because one physician can assist and prepare devices like stents and catheters and wires while the other physician gets a catheter into place, and this allows the procedure to be done much more rapidly.
Working from the groin artery, we passed a catheter to the left common carotid artery. This angiogram picture shows the carotid dissection. Here it is again, viewed from 90 degrees. The artery opened nicely with stenting.
And immediately after the carotid artery was stented, took her to the operating room and removed her spleen.
Bonnie, any neurological problems since our work?
Not since the surgery.
The next day, our rehabilitation specialist, Dr. Steinley, came to see Bonnie.
We were able to start therapy while she was in the ICU. We addressed her orthopedic rehab needs, as well as looked for any kind of subtle deficit she might have had from her carotid dissection. Once she was medically stabilized, she was admitted to our comprehensive rehabilitation program, where she remained in the hospital for 3 weeks. At that point, we were able to discharge her to outpatient therapy back in her home state.
Thank you, Bonnie, for telling your story. Complex cases require a crack team of specialists. I'm proud to be a member of the team at the St. Luke's Marion Block Neuroscience Institute. Another stroke, gotta go.